And here we go with another edition of Family Health Experts, visiting with Dr. Whitney Cope of Audiology and Hearing Center. And if you have a hearing-related question, give us a shout. We'll try to get that answered for you here in the next 3 minutes or so. 1-888-208-6946. Have a question from Jenny, who says, can you give me some advice on getting my husband to have his hearing checked? It's really getting to be a problem at home and in social settings. How often do you hear that?
All the time. No one wants to come to our office, but it is one of those things that the quicker you act on it, the better the outcome. So even if it doesn't warrant a hearing aid or anything, having a baseline as a reference point in the future is good. It's also a scenario most of the time where you don't know what you don't know, so you're probably missing more than you realize, and it can start to affect you, socially, cognitively. There are a lot of effects of untreated hearing loss, so it's really important if you think there are issues or if your loved one thinks there's an issue to, try to act on it as quick as you can.
Our next question comes from Rocky, who says, I have hearing aids, but I still have difficult time hearing in restaurants where it gets a little bit noisy. Is there anything I can do? And I'm guessing this might have something to do with the brand of hearing aids he has. Are they adjustable? Are they not?
Right. So there are definitely features in hearing aids now to help in, different environments and, more complex noise. So, we can have an app where you can adjust and have a different memory or program for restaurants and that kind of thing. And if it's a, more severe hearing loss, they even have things like remote microphones that you can give a companion to wear to stream the sound into the hearing aid. So there are options. I would recommend going back and having some adjustments or any.
Next question comes from Danica, who says, my mother is having some irritation from her hearing aids. Could it be that she's not putting them in correctly?
Definitely. So they are, ear specific, fit to right ear or left ear. So I would recommend going to have maybe some counseling on insertion and removal, because it is important that they are positioned properly in the ears, and it can cause discomfort if they're not.
Next question comes from William, who says, I've noticed that as I've gotten older, I have started to develop more earwax. Could this damage my hearing aids or my hearing?
So generally earwax doesn't cause a permanent type hearing loss, but it is important to get it out, especially if you wear hearing aids, because it can change the function of the hearing aid. So, I would get it removed. But it generally doesn't cause a permanent situation.
Got about 30 seconds left, and real quickly, how often should people have their hearing checked?
We generally recommend about once a year, or sooner if you notice any changes or anything in the hearing or other symptoms, ringing in the ears, pain, pressure, fullness, dizziness, those balance issues. So at least once a year.
Dr. Whitney Cope of Audiology and Hearing Center has been our guest on this portion of Family Health Experts. If you'd like to review this segment, you can do so shortly online at WPSDLocal6.com.